So this is always the question, and that's what we discuss with patients. I think obviously, at least, when we talk about transplant, we are most of the time talking about transplant for myelofibrosis, because at diagnosis, ET and polycythemia vera, disease risk does not justify, the transplant, because those patients have long survival. Most of the time when we are talking about transplant, we are talking about transplant for patients with myelofibrosis. And in reality, it's the only curative option for those patients. But the cures are not 100%, they are 40–50%, and there is always the transplant-related mortality that's 10 to 20%. So it's like weighing the benefit and the risk. And I tell patients, especially if they are candidates for transplant, I say it's not a matter of do you need the transplant or not, it's a matter of timing of the transplant. So if I see disease features that are bad, and that this is the disease that's going to be life-threatening for the patient over the coming 2 or 3 years, I think transplant, is benefit outweighs the risk. While if somebody have a very low-risk myelofibrosis, where the estimate of survival is 10 years plus, I don't think you can take the risk. So that timing question, we keep refining based on many things. Obviously, the more we understand the disease to identify those patients that have higher risk, we're probably going to go earlier in those patients. But also, as we start getting many therapeutic options that may actually change that and make patients, do better or reverse some of the disease, we may be able to delay the transplant. So it's moving target based on our ability to know the disease risk and our prognostic tools in a way, and also based on the current treatments we offer. And always, sometimes if patients were reluctant on this, I also tell them we have to almost get a sense of the trajectory of the disease. So if you observe those patients over 6 to 12 months, sometimes you'll be able to tell, is this something that's going to be stable, or I see, signals that this is disease progressing, then I'll be more inclined to go to transplant. So it's really moving target, and it is one-to-one discussion with patients, but there is no doubt that as of today, transplant is our only curative option for patients with myelofibrosis.